welcome back to the MI Mental podcast. My name is Dr. Sabine Fonderson, where we take a deep dive into real life cases of healthcare professionals navigating the tricky waters of legal and disciplinary hearings. Today's episode for my Doctors in Court series is particularly important for healthcare providers who prescribe medication over long periods. I'll be looking at a case that involves the management of statins, patient communication, and professional accountability. This case is based on real events, but to protect the identities of those involved, I'll be using fictional names. Our patient in this case we'll call Mary had been under the care of Dr. Clara, who in this case is her general practitioner, for many years. Today, I'll walk through the timeline, the complaint that Mary raised, the defense from Dr. Clara, and the disciplinary board's final decision. I'll also explain some important medical terms related to this case so you leave with more than just the story. Let's set the stage by breaking down the timeline of events. 1996. Mary became a patient of Dr. Clara. She regularly visited for treatment related to long-standing musculoskeletal complaints which stemmed from an accident in 1970. 1998. Dr. Clara noted that Mary's cholesterol levels were elevated at 9.9 millimoles per liter, with LDL levels at 7.3 millimoles per liter. Mary began dietary modifications to manage her cholesterol, and over time, her levels improved slightly, though they remained high. 2003. After several years of conservative treatment, Mary's cholesterol spiked again to 8.1 millimoles per liter. Dr. Clara prescribed simvastatin, starting at 20 milligrams per day and later increasing to 40 milligrams per day. This would become a long-term management plan for Mary's hypercholesterolemia. April 2007. Mary began to experience muscle pain and weakness. And during a visit with Dr. Clara, she mentioned difficulty with everyday tasks such as climbing stairs and dressing herself. Dr. Clara ordered blood tests to rule out conditions like hypothyroidism or polymyalgia rheumatica. The results were normal, and Mary's complaints were not linked to a statin use at that time. June 2007. Mary's condition continued to worsen. A physiotherapist contacted Dr. Clara, expressing concern that Mary's health was deteriorating significantly. Dr. Clara advised Mary to stop taking simvastatin and referred her to a geriatric specialist. October 2007. A neurologist diagnosed Mary with toxic myopathy, likely caused by long-term statin use. Dr. Clara subsequently reported the adverse reaction to the National Adverse Drug Reaction Center. Following these events, Mary filed a formal complaint against Dr. Clara, which leads us to the details of the case. Mary's complaint against Dr. Clara focused on several points. Number 1, failure to warn about statin risks. Mary claimed that Dr. Clara did not adequately inform her about the potential risks associated with long-term statin use. She argued that had she been made aware of the possibility of developing muscle-related side effects, she may have reconsidered or sought more regular monitoring for her condition. Number 2, delayed referral to a specialist. Mary felt that Dr. Clara should have referred her to a specialist much earlier when she first started experiencing symptoms in April 2007. She believed the delay contributed to the worsening of her condition. And complaint number 3, prescription after advising to stop statins. Despite advising Mary to stop taking statins in April 2007, Dr. Clara authorized a prescription for the medication shortly afterward. Mary argued this added to her confusion and worsened her condition as she continued using the drug. Mary's case revolves around claims of miscommunication and inadequate management of her long-term care. So let's now look at how Dr. Clara responded. Dr. Clara's defense was based on 3 key arguments: appropriate prescription and monitoring. Dr. Clara argued that her prescription of simvastatin in 2003 was in line with standard practice for patients with high cholesterol, particularly those like Mary with a family history of heart disease. For many years, Mary did not report any side effects from the medication, and her cholesterol levels were being managed well. Investigating symptoms. Dr. Clara emphasized that when Mary reported muscle weakness in April 2007, she immediately ordered blood tests to rule out other possible causes. Statin-related myopathy is a rare side effect, and at the time, there were no clear indications that the statin was responsible. Prescription error. Dr. Clara acknowledged that she had mistakenly authorized a prescription for simvastatin after advising Mary to stop taking the medication. She expressed regret for this oversight, but argued that it was a clerical error and not a reflection of her overall management of Mary's care. Dr. Clara's defense highlights the complexities of managing long-term medications and the challenges of diagnosing rare side effects. Now, let's move on to the disciplinary board's decision. The disciplinary board ruled on the following: failure to warn. The board found no evidence that Dr. Clara failed to warn Mary about the risks of statin use. They noted that simvastatin had been prescribed in accordance with best practices and muscle-related side effects were rare. The complaint that Dr. Clara failed to adequately inform Mary about the risks was deemed unfounded. Delayed referral. The board agreed that Dr. Clara's referral to a specialist after Mary's symptoms worsened in June 2007 was appropriate. Given the rarity of toxic myopathy as a result of statin use, Dr. Clara's initial approach of investigating other potential causes, such as hypothyroidism, was reasonable. This complaint was also deemed unfounded. Prescription authorization. However, the board did find Dr. Clara at fault for authorizing a prescription of simvastatin after advising Mary to stop the medication. This was seen as a preventable error and a breach of professional responsibility, though it was classified as a minor mistake. The board issued Dr. Clara a formal warning. While Dr. Clara was not found guilty of serious malpractice, the case underscores the importance of careful management and communication in long-term patient care. Let's take a moment to break down some of the key medical terms that were central to this case. Simvastatin. A statin medication commonly prescribed to lower cholesterol levels and reduce the risk of cardiovascular disease. Statins work by blocking a substance the body needs to make cholesterol, but they can occasionally cause muscle pain or weakness. Toxic myopathy. This refers to muscle damage caused by a toxin, in this case a statin. Statin-induced myopathy is rare but can result in muscle pain, weakness, and elevated levels of creatine kinase, CK, in the blood. These terms help frame the complexities of managing long-term drug therapies, where the benefits must be weighed against potential risks. Before we wrap up, here are 2 questions I would like you to think about. Question number 1. How can doctors ensure that patients fully understand the risks of long-term medications, especially when the risks are rare? Doctors can emphasize the importance of regular monitoring and provide detailed information about possible side effects, even if those side effects are rare. Ensuring that patients feel comfortable asking questions about the medication is key to maintaining open communication. Question number 2. What can healthcare providers do to prevent errors, such as prescribing medication that has been discontinued? Implementing checks in the prescription process, such as reviewing recent consultation notes before authorizing repeat prescriptions, can help reduce the risk of errors. Additionally, involving patients in this process can act as a safeguard, ensuring they understand changes in their treatment plan. Thanks for tuning in today's episode. If you enjoyed this discussion, be sure to subscribe for more Doctors in Court series right here on the Am I Mental podcast. Until next time, take care.